Good evening. So as you've heard, my name is Maureen Akolo. I work for an NGO that is actually funded by University of Manitoba, but also has support from PEPFAR CDC. So PHDA, which has been having several names, including SWAP, TSU, and all that, was actually started in 1979. So we're going to celebrate 40 years in January. And we had researchers coming from Manitoba to look at chancroid among female sex workers. So when they were doing studies among the female sex workers, collecting samples, they're also testing for HIV. And they actually stumbled on HIV, whereby 60% of the female sex workers were HIV positive. So they actually changed tact and started looking more on HIV. So what happened is they came up with other research, research whereby they looked at how long it takes a female sex worker to seroconvert. So most of the sex workers were home-based sex workers, because most of them were immigrants from Tanzania and Uganda. So as long as they found out that as long as they continued having sex, they actually remained HIV negative. But by the time they went home, they went back to their homes in Uganda, they took a sex break, and the time they came back and started engaging into sex work again, they actually seroconverted. So they continued like that, and then we got some funding in 2005 by PEPFAR CDC to take care of general population. We opened up 2 more facilities to take care of HIV positive individuals, and we managed to enroll around 11,000 HIV positive male and female and children from the general population. In 2010, we got funding for KP, key population, whereby we opened several facilities, and at the moment we have 7 facilities which are taking care of 22,000 female sex workers and around 1,400 men who have sex with men. These 22,000 and the 1,400 are a mixture of HIV positive and negative individuals, because our program is a prevention program. So PHDA, what we do is we have a vast experience with KPs, and we serve as a technical support unit, whereby we've actually trained a lot of people, including different countries like Congo. Yeah, they've come and visited our organization to learn about biometrics, to learn about programming of sex workers. We've also been key support to other upcoming KP organizations in our country. And so what we do, we offer, it's a SWAP, or PHDA is a one-stop shop. We offer safe space for sex workers, both male and female. We give all the services in SWAP. We take care of HIV, yeah, prevention, care, and treatment. When I talk about prevention, we have things like condom and lubes. We offer them for free. Yeah, we have biomedical prevention, that is PrEP and PEP, is offered in SWAP among the HIV negative. We have STI screening, we have TB screening and treatment, we have hepatitis screening and treatment, of course, and HIV. So our program has been a successful program, because if you look at the sex workers who have stayed in the program, the HIV incidence is at 2.2, compared to what is happening for those ones who have not been in the program. Something else is we've actually empowered the community. We work together with the community. We work together with the community, whereby we have different groups in the community. We have an advocacy group. Yeah, this advocacy group is made up of female sex workers and male sex workers, whereby they take care of themselves, each other. In case one has been arrested by the police, they're the ones who are in the front line to go and talk to these police officers and call each other and take care of each other. So for instance, if one was arrested working, they'll talk to the OCPD on the importance of making sure that this sex worker continues taking their drugs, if it is PrEP or ART. They'll mobilize one of their own to run to the house. So because most of these sex workers, sometimes they actually lock their children at night in the house to go and do sex work, and then hoping that the following day in the morning, they'll come and open the door and take care of their kids. So one of them will run to the house and make sure that the kids for their fellow sex worker actually are in safe hands. So we also have the champions for positive health and dignity, PHDP. So what they do is they are HIV positive sex workers who have come out to talk about their status freely. So they help by following up the sex workers who are positive and in denial. They talk to them, they encourage them, they even offer home visits and even wash them up when they are bedridden and all that stuff. We also have sister to sister HIV negative sex workers who actually talk to their fellow HIV negative sex workers to ensure that they remain negative by telling them how to negotiate for sex, how to use condom, where to get the lubes and all that stuff. We also have another group that takes care of, it's a respect case, an EBI, Those ones who are talking to the positive ones to ensure that they actually know how to negotiate for safer sex, remain on their treatment and all that stuff. So that is what we do in a PHDA, but also wanted to say that it is a peer-led outreach model whereby apart from having the clinic staff, we have an outreach group that comprises of the prevention officer. A prevention officer is a staff who is qualified maybe in community health, HTS counseling and all that. The prevention officer works together with an outreach worker. The outreach worker mans several peer educators, and these peer educators actually man several hotspots. So the peer educator is the one who's supposed to mobilize the female sex workers at the hotspot in case there's a service that is going there. So we have satellite clinics that are taken to the community, and they offer all the services, because you realize that there are some sex workers who don't want to come to the facilities. They don't want to be identified by other people that they are sex workers. So we take all services to the community through this outreach model, whereby also the outreach model helps us to retain the sex workers into the program. Because if we miss out on a sex worker, the peer educator is supposed to tell us where this sex worker has gone. Maybe she's sick, or maybe she relocated up country and stopped having sex, selling sex in the city. So those are things that we do. But also I want to talk about what Professor has talked about, empowering the healthcare workers. If you look at the curriculum in our country, there's very little stuff that has been put on HIV, ARVs, and KP, So you find that if somebody has to be employed into these NGOs that are taking care of HIV positive clients, they must undergo extra training, So they have to undergo extra training, and now if they undergo extra training for HIV, again, when it comes to KP, they must undergo some other sensitization about how to handle KPs. We have had staffs who've been hired, but when they come, they leave the next day because they cannot handle MSMs, they cannot handle FSWs. And you know, our facilities are safe space. So in a safe space, we let the sex workers talk their language, Some might find it not an easy language to handle, so they actually leave work. Some will stay there, but they'll start thinking of how to pray over these clients to leave sex work, like to change and all that stuff. So it is something that we should look at. If you look at the staffs who are working in the hospitals, they don't have this information, because when they receive clients from the CCCs, maybe these clients are very sick, they're bedridden. They'll always ask, have you taken your HIV medication? They don't even know the dosage of this medication this client is taking. They don't even know the name. They don't know anything about these drugs. So they don't even offer comprehensive care when it comes to a HIV client admitted in the hospital. So the same thing. So there's a gap in the healthcare workers working in the hospital and healthcare workers working in the CCC. Because you find, if you've been a nurse in the CCC, your nursing knowledge becomes half-life, because you rarely practice any nursing in the CCC. You're just doing HIV care and all that stuff. So yeah, that is from SWAP. That is what we do. Yeah, thank you.